Hello, I'm Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for people with rosacea. Tip number 1, when to suspect rosacea. Rosacea is an extremely common skin condition. It's more common in lighter skinned individuals, and it usually begins in adults in their 30s. It can cause red nose or red cheeks. It can also cause pustules to form, and it can create different conditions that affect the eye. There are four main types of rosacea. There's erythematotelangiectatic, which basically means there's redness, and there are telangiectasias, which are just enlargement of the blood vessels, which you can see on the skin. The next type is papulopustular, which means that it looks like acne. In this subtype, there are red bumps and sometimes pustules form. Then there's the third subtype is ocular, which can cause a variety of different conditions that affect the eye, including eye redness and the feeling that there's something in your eye. And phimosis, Phymmatous, which actually causes skin growth of the nose and the central face area. Tip number 2 is make sure you see your doctor if you suspect that you have rosacea. It's important to diagnose rosacea, for a physician to diagnose rosacea. It's also important to make sure that there's not another skin condition that's causing your skin changes. And it's also important to have you referred to a specialist if necessary. With ocular rosacea, the form of rosacea that affects your eye, you should be referred to an ophthalmologist or an eye doctor. Tip number 3. There are several general measures you can take to prevent occurrences of rosacea. Rosacea usually occurs in periods and then goes away for a period of time and is a chronic condition. So there are a few ways to avoid the triggers of rosacea. So the first general measure for tip 3 is avoiding flushing. Flushing meaning anytime your face gets red. It might be helpful to keep a diary and to determine what your triggers are for flushing, as it can vary between individuals. Potential triggers that can cause rosacea and that can be avoided are temperature changes, extreme temperatures, hot beverages, sunlight, spicy foods, and alcohol. So these are triggers that you can use to avoid episodes of rosacea. And it can also decrease the severity of rosacea in the long term if you can avoid these triggers. Again, they are extreme temperatures, hot beverages, sunlight, spicy foods, and alcohol. Tip number 4. Another general measure to help control rosacea is skin care and sun protection. It's important to use a skin moisturizer frequently, such as twice a day. Applying a moisturizing cream to the face twice daily can improve skin dryness and the discomfort that's associated with rosacea. Also, it's important to use a gentle skin cleanser and to cleanse with your face with lukewarm water, and to use your fingers to wash your face, avoiding any kind of hard mechanical scrubbing. Beauty bars, mild cleansing bars, and facial cleansers are better than traditional soap. So for instance, Dove would be better than Ivory soap. And avoid irritating topical products. Avoid any products that may irritate the skin, such as a toner or astringent or chemical exfoliating agent. And avoid any manual exfoliation with rough sponges or cloths. Furthermore, sun protection is important, and people with rosacea should apply daily a broad spectrum sunscreen with a sun protection factor or SPF of at least 30, and should avoid the sun when it's at its strongest during the middle of the day. Tip number 5. Another general measure for controlling rosacea is cosmetic camouflage, or covering up the skin changes that are caused by rosacea. Generally, this can be accomplished with a green tinted foundation, a makeup green tinted foundation to cover up facial redness, and then a flesh colored facial foundation on top of the green tinted foundation to achieve a skin color that matches your own complexion. Tip number 6. So we talked about general measures to control and prevent rosacea. Now, for the subtype of erythematotelangiectatic rosacea, or the one that causes redness and being able to see skin vessels, but not the pustular form, the best treatment is a laser or intense pulse light therapy. And this is recommended if your rosacea is not adequately controlled by the above lifestyle changes that I described. So that's tip number 6, was the treatment for erythematotelangiectatic rosacea. For tip number 7 is the first line treatment for papulopustular rosacea. So this is the rosacea that looks like acne with skin bumps and nodules. The first line treatment is metronidazole, a topical gel, 0.75%, that can be applied twice daily for about 12 weeks. And it will often need to be reused after your initial treatment, because rosacea is a chronic condition and metronidazole does not completely eradicate it. It just makes a flare go away. If you are not able to control rosacea with metronidazole topical gel, then ask your doctor about an oral medication. Also, an oral medication is recommended if your rosacea is moderate or severe. The recommended oral agent typically is oral doxycycline, 50 to 100 milligrams twice daily for 12 weeks. It's also important to avoid sunlight when you're taking doxycycline. And it's important in children to avoid doxycycline for any kind of tetracycline. Doxycycline is one type of tetracycline. Tetracycline should be avoided in children who are under 9 years old. And tip number 9, again for papulopustular rosacea. If the rosacea is severe or it does not improve after trying the topical metronidazole or the oral doxycycline, then oral isotretinoin is recommended, usually a 0.2 milligram per kilogram per day, until inflammation goes away, and then continue it for 2 more months after the inflammation goes away. This usually requires a course of about 6 months total of therapy. And tip number 10, believe in yourself. Rosacea is a common condition, and it can be effectively prevented and controlled with the measures I've described. I hope these tips have been helpful. Thank you very much for listening, and have a great day.